So I'll be reading. Good morning, everyone. Thank you so much for joining us. So I'll be reading about our speaker, Dr. Kristin Rojas is a fellowship-trained breast surgical oncologist and board-certified gynecologic surgeon with a passion for comprehensive wellness in women's cancer care. Originally from Texas, she graduated from UT Southwestern Medical School and completed her residency training at Brown University / Women and Infants Hospital, followed by a Society of Surgical Oncology breast surgery fellowship at Maimonides Medical Center in New York City. As an attending surgeon, her research focuses on opioid minimization in breast cancer care, sexual health in women's care survivorship, and the use of preoperative MRI in women with early stage breast cancer. She is the founder of the Menopausal Urogenital Sexual Health and Intimacy Program, a program for women experiencing sexual dysfunction after cancer treatment. In 2019, she received the Rudolph Neeson Research Award, and her work was recently published in Breast Cancer Research and Treatment, Annals of Surgical Oncology, and the American Journal of Surgery. I hope I didn't watch that too much. Thank you so much, Dr. Rojas, for joining us.
Thank you so much, Jareen, for that introduction. I'm sorry you got the longer version of my bio and my old hospital's called Maimonides, and it's impossible to pronounce. So thank you so much. I really appreciate it.
My pleasure.
My name is Dr. Kristin Rojas. I'm a breast cancer surgeon. I'm also a board certified GYN. I actually started out my career in gynecology before crossing into surgical oncology. So let me just share my screen with all of you. And I'm very happy to be here. Thank you so much for inviting me. And what I'd like to do actually is give you this short-ish presentation, and then I want all of you to feel free and to leave plenty of questions, time for questions at the end. If you'd like to write your questions in, or we can talk about them after the presentation. I wanted to make sure I left some time for that. So let me just start here. So I'll get started. So as I said, I'm a breast cancer surgeon. I currently work at Sylvester, University of Miami. I did recently move from New York City, where I'd originally heard of Gilda's Club. And so I'm so happy to be invited to speak to you guys today. So please feel free to write in some questions. I believe there may be a chat function. I believe I see it in there. And so if you'd also like to take any screenshots of my slides, or post online, save them for yourself. You can always tag Sylvester or myself on Twitter, Instagram. Remember, for all of you, this is for informational purposes. So you always want to talk to your own doctor that knows you best before making any changes. I don't have any financial disclosures related to my program, which is actually called MUSIC. It stands for Menopause Urogenital Sexual Health and Intimacy Center or Clinic. And it is for women with a history of any type of cancer experiencing sexual side effects of treatment. And so I don't take any money from any brands, products, or services. The MUSIC program does have an Instagram. And so a lot of times, all the information I'm going to present for you today is from my experience over the last 3 years running this program, but also direct feedback from patients. And so please feel free to look up that Instagram. So many of you, my impression is that we have patients with a history of more than one type of cancer in this audience. I know a lot of women may have breast cancer, but I also wanted to make sure that we catered this talk to women who have a history of other type of cancer, like GYN cancer or any other type of malignancy. But regardless of what type of cancer you have been treated for or are undergoing treatment for, or have a loved one who's undergoing treatment for, the story is the same. It's a lot of information when you're diagnosed. We get you started on treatment. It's basically information overload. We try to tell you as best we can about the side effects that you might experience. And I actually think we're doing a much better job about this now than we did 10 years ago, but you may have started to experience some of the sexual side effects of treatment. And if we maybe didn't mention that, you go to the trusted Dr. Google, and what you see if you put in, sexual dysfunction or sexual problems is it's all about erectile dysfunction. And this is really one of the problems with addressing the issues that women have after cancer treatment, is that, there's not a ton of options, and the options that we do have, either women don't know about, or maybe we've told you that they're not safe for you. And so it's very complicated. So I'd like to take this from the problem that we don't talk about to the problem that we will talk about, and just make these issues normal conversation, because they do come up and can really disrupt our patients' quality of life. And so first thing I want to just stress to all of you is these problems are extremely common. More than 90% of women who are on aromatase inhibitors, which is the estrogen blocking medication, experience these issues. Women with a history of other types of cancer experience these issues, like more than 80% of women. And so it's very, very common. We haven't done a great job talking about it, but hopefully after today, everyone feels more comfortable with this. So first, before I tell you guys, you lovely women, how I manage these symptoms as a physician, I want to just briefly talk over a quick anatomy lesson, because I feel like this is really helpful when I'm talking to patients about best ways to treat these problems. So on the left is an artistic interpretation of the uterus, the two fallopian tubes, and the ovaries, which are where estrogen is made. The uterus is where babies grow. It's attached to the vagina by the cervix. And then on the right is the vulva. So the vagina is inside and the vulva is outside, is how I explain it to my patients. And so it's a labia majora, labia minora, and I feel like that's really important for some of the things I'm going to talk about. So menopause can cause either a temporary or permanent so chemotherapy can cause either a temporary or permanent menopause. And the reason that happens is because it basically turns the ovaries off. So they stop making estrogen. A lot of the symptoms that you feel after that, and which are symptoms you can also feel with ovarian suppression, such as Lupron and Zoladex, are because of the estrogen being really low in your body. And so it's literally an estrogen withdrawal. And it can kind of feel like an alcohol or a drug withdrawal. Women who've maybe had pelvic radiation for GYN malignancies also can have some, this can damage the ovaries and put them into menopause. Medications called aromatase inhibitors like anastrozole, letrozole, and exemestane block estrogen that's produced in the fat cells. And, we all have fat cells that make estrogen. Tamoxifen and raloxifene actually block estrogen at certain places in your bodies. And it's supposed to block the estrogen in your breast. So what I tell my patients is, it's like you're wearing a shield, protecting your breast against any estrogen that might be floating around your body. But these drugs have a lot of secondary effects. They have effects on other delicate tissues in your body, not only your bones and your brain, but also the vulva and the vagina. And so low estrogen can cause less lubrication or wetness, less stretchiness. I also call this elasticity, increased infections, vaginal pain, and spotting after sex. I just want to set my timer so I don't go over with you guys.
Dr. Rojas, is there a way to make it full screen?
Am I not sharing the right screen? Hold on one second. Is it full screen where you see?
Yes, now it is. Thank you.
Oh, I apologize. I was sharing my double screen. Sorry, everyone. I hope there weren't any notes on there, but great. So moving on, apologies. So these symptoms can happen with cancer treatment at any age, and they're extremely common. So the first thing I'm going to tell you is about how to manage menopausal symptoms. So first, tips for hot flashes. Hot flashes, like I said before, are when the estrogen is really low. It's basically the body's estrogen withdrawal. They can be, hot flashes can be managed with medication aspects, and one of those is by exercise. So high intensity exercise in the morning can help decrease the intensity and the number of hot flashes you have later in the day. You can also dress in layers. I'm sure some of you have heard this if you've experienced hot flashes. And these actually can be really, really distressing if you're waking up multiple times at night. The next day is really disrupted. And so there are certain triggers that can trigger hot flashes, like spicy foods, alcohol, basically anything delicious, it sounds like, or like chocolate, things like that. And acupuncture has been shown to be very helpful for hot flashes. And this is something we offer at Sylvester. We have actually an acupuncturist that helps women undergoing treatment who are experiencing hot flashes. And also acupuncture can be very helpful for bone pain or joint pains. There are some non-hormonal medications that we can use. Number one is venlafaxine, which is actually a low-dose antidepressant. It's also called F.A.C.O.G. The problem with hot flashes is, even though you're feeling them in your whole body, they're actually a problem with your brain. Basically, your brain's thermostat is saying it's too cold in here. And so the thermostat is completely disrupted. And so the way we target that is by treating medications that work in the brain. And so venlafaxine or F.A.C.O.G at really low doses can be helpful. Another medication called oxybutynin, which has traditionally been a medication for overactive bladder, can also significantly decrease hot flashes. Rolizin is a pollen extract from Bonafide. Bonafide is a company that makes a lot of non-hormonal products, and this Rolizin supplement has been shown to decrease the intensity and the frequency of hot flashes. And so it's not regulated as like an FDA approved medication, but some of my patients have found relief with Rolizin. Venlafaxine and oxybutynin are really my go-to though when I'm treating patients with hot flashes. They're very, very effective. So the most common symptom patients report when they report to me when they present to the Music Sexual Health After Cancer program is that that they're having painful sex. And so this can be due to irritation or a couple other issues, irritation or dryness. So a lot of times when patients present, a lot of times when patients present, they actually have a low grade allergic reaction, because when some patients experience dryness from treatment, they may, it's really common to use some like over-the-counter products or maybe home remedies. And so the delicate tissues of the vulva and the vagina are actually really sensitive to those chemicals in different products. And so when I see patients, sometimes they actually have an allergic reaction that's manifested as itching or really or burning, et cetera, or swelling. And so you want to limit chemicals that touch the delicate vulva and the vagina. And that's here from our previous picture. The vagina actually doesn't need soap, really, it just needs water. So any product that's marketed as like a feminine wash or any kind of delicate soap, even Johnson & Johnson or Dove, the vagina really doesn't need soap. And the problem with using soap in the delicate tissues of the vulva and the vagina is that the vagina is a balance of good and bad bacteria. And so the good bacteria are also known as lactobacilli. And these soaps can really can decrease the good bacteria and cause that the bad bacteria overgrow. So even if products like Vagisil or these feminine washes may work temporarily, what they do is completely disrupt the balance between that bacteria, and it ends up being that you have to just keep using these products over and over. So I tell patients, just stop using those products and only use water. So you don't want to use anything that has glycerin in it. So read the ingredient labels. Anything that touches the delicate skin of the vulva and the vagina, including detergent, soaps, boa baths, panty liners, tampons. So the detergent that you wash your underwear in, make sure it doesn't have any extra fragrances. We can have allergic reactions to the chemicals in those detergents without even realizing it. I always tell my patients particularly if they're prone to recurrent infections called bacterial vaginosis or BV, which is an overgrowth of that bad bacteria, that particular bacteria actually is what we call an anaerobe, and it doesn't like oxygen. So I tell them to sleep without underwear. So that's me, a physician, telling you it's okay to sleep without underwear. So I call that airtime. So this next step after eliminating irritants when managing painful sex and other vulvar and vaginal irritation is to talk about incorporation of daily moisturization. So this is, I'm going to start with non-hormonal options. So this is different than lubricants or like KY, et cetera. And so just like you moisturize your face or your under eye, you also want to consider moisturizing the vulva and the vagina. This really helps prevent some of the irritation after sex. It helps with lubrication. And I tell patients if they shower at night, doing it after a shower is really helpful because the skin maintains some of that moisture. My go-to for everyone is to start with single ingredient organic coconut oil. Everyone already has it in their house. You know, it's solid at room temperature. So you take it in your fingers, rub it in your fingers like this, and you can place it on the external vulva. This also helps prevent burning after you pee, after you urinate, which some women experience after sex. And so this can be really helpful and a good way to start. There's also vitamin E suppositories, which you can get online. The problem is with these suppositories, they're little vitamin E capsules you place in the vagina, is that they can melt and be a little bit messy. And so I have patients place those right before they go to bed. There are some newer products on the market that have what's called hyaluronic acid or lactic acid in them. And these are really great and they're long lasting and they're very effective without the use of hormones, safe for women with a history of cancer. Hyaluronic acid works by taking moisture from the environment and placing it on the skin. And so it helps maintain moisture in those delicate tissues. Here are some brands that don't have a lot of those extra gimmicks that we talked about, like fragrances, etc. Good Clean Love, Hyalogyne, Reverie are really good brands. You want to avoid petroleum-based products. And if you're someone that's using condoms, that also can degrade condoms. So keep that in mind. And then for women who have recurrent bladder infections after sex, so what can be really helpful, and once you can ask your doctor about a single dose pill that you just take after sexual activity, and that's macrobid or nitrofurantoin. So I can ask your gynecologist about that. Daily moisturization and lubrication are not the same. Like I said before, lubricants are before sexual activity, whereas moisturization is for maintenance. So there's also non-hormonal options, and now I'm going to talk about hormonal options. And hormonal options are actually really helpful for women who have a history of GYN cancers, so like cervical cancer, ovarian cancer, not for women with uterine or endometrial cancer. And, you know, even some women with breast cancer can use vaginal hormones, and I'll talk a little bit more about that. Sometimes the vagina can actually get narrower or shorter with treatment, and that's from those really low levels of estrogen. And so that can make sex really painful after treatment. And the way that we fix that is by using vaginal estrogen and a dilator to help stretch those tissues to make sex feasible again. If you're someone who's also newly having a lot of pain with pelvic exams when you go to the gynecologist, this may be why, and it's called vaginal stenosis. And so I talk to a lot of patients about using dilators, which can be done with the help of a pelvic floor physical therapist. And this can help make the vagina where you're able to have sex without pain. Vaginal estrogen is estrogen just placed on the vagina. It's different from systemic estrogen. So systemic estrogen is when we take a pill or put a patch on your skin. And so we do not recommend systemic estrogen for women with a history of breast cancer that's estrogen receptor positive, but vaginal estrogen is different. And so vaginal estrogen has not been shown to increase the risk of recurrence from breast cancer, even in women who have estrogen receptor positive breast cancer. It's probably the only treatment that helps with recurrent bladder infections. For these women, you know, I'll start with the non-hormonal options first, but sometimes when the symptoms are very, very severe, vaginal estrogen is the only thing that's going to make those better. There's really not, there's a little bit absorbed into the bloodstream in the beginning, but then later on, it has not been shown to be absorbed after the first couple of treatments, and there's no increase in the risk of recurrence. The newer treatments are what are called vaginal androgens. Androgen is another type of hormone that's like testosterone or a derivative of testosterone called DHEA. This is also known as progesterone, which is FDA approved for painful sex. And the brand name for that is Interosa. And this DHEA, it works like a little bit of testosterone there in the vulva and the vagina, does not increase the risk of recurrence, does not increase the amount of estrogen in your body. You want to discuss all hormone treatments with your doctor. And remember, so, you know, for estrogen sensitive breast cancer, you always want to talk to your doctor, try non-hormonal options first, but vaginal estrogen is actually not contraindicated. But for women with a history of who've had pelvic radiation, vaginal estrogen is actually a really good first start. And so I always talk to women about that. Talking about lubricants. So you want to think about using a lubricant every single time for sexual activity. There's Good Clean Love and Blossom Organics make a really good water-based lubricant, but I actually recommend for my patients using silicone-based lubricants. They last longer, they're hypoallergenic, you don't need to reapply them. Sometimes water-based lubricants can be sticky, although they're good, they're safe with silicone toys and safe with condoms. Silicone-based lubricants are really helpful. There's some hybrid brands, and then there's also oil-based products, which I actually don't really recommend for my patients. I don't think they work as well as a lubricant. This is different from the moisturization or the maintenance that I told you about. This is just for sexual activity. Remember, you don't want to use oil-based moisturizers or lubricants with condoms because they can degrade them. There's some newer products out on the market like CBD lube. You know, these haven't really been shown to be effective, but they're new, and so we'll see. These are the chemicals you want to avoid in any products that are going close to the vagina, and that also includes lubricants. So I do not recommend KY. KY has a lot of chemicals in it. I don't recommend, Astroglide also has a lot of chemicals, and so you really want to read the ingredients list and make sure you're not using a product that has glycerin or other chemicals that are difficult to pronounce, essentially. So you want to start early, even during treatment, before you even feel these symptoms, check in with your body, check in with your oncologist, your partner, and yourself, start the discussion, incorporate moisturization into your regimen. You always want to read labels, find strategies for managing pain, and consider dilators through treatment if you're not sexually active, because don't have sex during treatment, then the vagina can shorten and narrow during treatment, which is always harder to treat later on. So the next topic is probably the most complicated aspect to treat. A lot of women report that they have low desire or low libido after treatment. And this is probably due to several different effects. One is low estrogen, which also means low testosterone. Testosterone is the hormone in our bodies. Women do have a little bit of testosterone, and that actually helps with desire and libido, even though we traditionally think of testosterone as just being in a male hormone. And so because there's lower estrogen, there's lower testosterone, it's also that, all of the psychiatric or psychological issues that go along with the diagnosis, the stress, and it's overwhelming. And so that can really contribute to this as well. It's important to know that what's called hypoactive sexual desire disorder, or HSDD, is extremely common in women who have not even had a cancer diagnosis. So women who've had diagnosis and treatment, it's even more common. And as a society, we haven't done a great job addressing this until now. And we could probably still do a lot better. The first thing I want to show all of you is this F.A.C.S website, where you can find a sexual therapist by your location. So whether you're in New York or South Florida, you can find a sexual therapist in your area. So my tips for low desire, first to know, it's not you, it's the medications that we have you on. It's the chemotherapy we gave you. So I start by treating dryness, pain, and what I call pelvic floor muscle dysfunction. So sometimes when women are having, if you've experienced painful sex, what happens is you start to have a lot of anxiety about that, because that's just a normal reaction. Our bodies don't want to do something that's painful. Once our brain starts to have that negative reaction, we can start to have spasms in different parts of our body that we don't even realize we're having. One of the places we have those spasms is in the pelvic floor. Pelvic floor is like a basket. So it's muscles that are kind of interwoven together, and they hold all of the important organs in your body. And when one of those muscles is spasming, it can cause a lot of pelvic pain and a lot of pain during sex. If you think that's you, a pelvic floor physical therapist is really, really helpful. So other tips for low desire, consider a medication adjustment. If you're on Zoloft or an antidepressant medication, those can be real libido zappers. And so the medication bupropion or Wellbutrin actually doesn't have any sexual side effects. And so talk to your doctor if that may be an option for you. Another option is to switch from an aromatase inhibitor to tamoxifen. Tamoxifen gets a really bad rap, but it's actually a really great medication, and the risks with tamoxifen are actually very, very low. The risks of endometrial cancer and blood clots are overestimated, and at least for a short period of time, tamoxifen can be helpful, because usually women can have an improvement in desire when that happens. You want to address communication and relationship issues, like F.A.C.S. And then I always tell patients about sleep hygiene. So no screens in bed. That means TV, Instagram. The bed should really be for sleeping and sex only. Other ways to increase desire: exercise. I cannot stress enough how important exercise is. You know, you feel better about your body, more happy hormones, happy chemicals released by your brain. And then also exercise and physical activity decrease the risk of recurrence. And we have really good data showing that now. You want to get to know your new body, you know, after treatment. And so I tell patients, if you're someone who jumped into sex before, that's not going to be how this is now. And that's not how it is for most people, because Hollywood isn't real life, you know? And so I always talk to patients about taking time to warm up. Don't be afraid of devices. You know, if you're going to use a sexual device like a toy, think of a silicone toy. You don't want to use, you want to have non-porous silicone, and always make sure that you clean devices and store them in a clean, dry place. I also talk to patients about these two podcast options. These are Dipsy and Quinn, and they're designed by women for women to kind of help increase these sexy thoughts. And so I've had some patients who really like that and can help them get in the mood per se. So there's two pharmacologic options. There's no female Viagra, unfortunately, even though there's 6 different types of Viagra on the market. Women don't have that. So the two options is either a daily pill or an injection before sex. So the pill is called flibanserin. It's also known as Addy. So if you're someone who drinks a lot, then Addy maybe isn't the right medication for you, because it can increase the dizziness and nausea associated with Addy. So we say 1 to 2 glasses of wine or something similar per day if you're on Addy, but more than that, you want to skip your pill, or maybe it's not the right medication for you. It's been shown to increase the number of sexual encounters per month by 1, which is how the studies were done. But if you're going from 0 to 1, that's a big deal maybe, but 5 to 6, maybe not so much. And so talk to your doctor about this option. Their website also has a lot of information. The other option is an injection, which you give before sexual activity. This came out last year, and I have not prescribed this yet. I just include this in this talk so that women know like what's out there. But honestly, I haven't been able to convince any of my cancer patients about having another injection. Usually people are not excited about it. There's no published results in women with breast cancer yet. That being said, both of these medications work in the brain. They're not hormonal, and so they shouldn't increase the risk of breast cancer or any type of cancer recurrence, excuse me. There's one non-prescription option that keep in mind, it's not FDA approved, so it's not regulated. It's based on some studies out of Europe using something called pine bark extract that has been shown to increase blood flow to the vulva and the vagina. And this is marketed as Ristella, another company, Bonafide, that I told you about. A lot of times patients ask me about alternative treatments and what treatments might be safe after cancer. So I just want to take this moment to tell you all that bioidentical hormones is a marketing term. This is really popular, especially down here in South Florida. You know, there are certain physicians or non-physicians who market these hormonal treatments as being bioidentical and therefore safer for your body. The way that bioidentical hormones work is that they take like soybeans, and then you make hormones out of them. But essentially, even though it's coming from soybeans, these are all made in the lab. And so there's all these different chemicals you have to give to those soybeans to turn them into like an estrogen that is used for your body. These estrogens from plants have not been shown to be safer than the types we prescribe. That being said, I think the reason that bioidentical hormones, like as a field, came out is because 20 years ago, we were giving women Premarin. So I don't know if you guys have ever heard of Premarin, but Premarin is a product. It's a pill or a vaginal cream, and it's made from horse urine. And I personally, originally being from Texas, like we do not take our horse abuse very lightly. And so I don't prescribe Premarin. I don't think anyone should be on Premarin. It's kind of a dirty drug, and then it has a couple of different types of estrogen. And so we can't really predict how patients are going to react, and it's just not, it's not good. And so it's not used that much anymore, but some prescribers are still using it. But today we can give you estradiol, and estradiol is the same molecule that your own body makes. And so it's essentially bioidentical, but we just don't call it that. And so this whole marketing thing under bioidentical or making hormones from different plant products that somehow are supposed to be safer, you know, they're not FDA regulated. You don't really know what's in them and what the amount is. And so I really do try to convince my patients, if we're using an estrogen product, that we use something that I know exactly the dose and exactly how much I'm giving you. And they are bioidentical. So there's really no known benefit to these bioidentical hormones as a marketing term. We have issues with purity, efficacy, and safety. Cancer is not caused usually from an imbalance of hormones. Just because you have had a history of a breast cancer with estrogen receptor positive doesn't mean there's anything wrong with your hormones. All that it means, doesn't mean that you had really high estrogen or low estrogen. What it means is that the cancer cells that you have specific to you use estrogen as a growth signal. So it doesn't say anything about the actual levels of estrogen in your body. I think that's a common misconception. And sometimes these providers who prescribe these like designer cocktails of bioidentical hormones can do different tests to show that maybe your certain hormone levels are lower or higher. And these are done on saliva, like so spit. And it's important to know that these tests are not accurate, they're not validated, and they're actually not, these levels of hormones fluctuate throughout the day. And so this way of measuring hormones actually isn't very effective. There's other ways of measuring hormones that are a lot more effective. I want all of you to be wary of expensive supplements. So if it's costing you $100 a bottle, someone's making money off of that. So just remember that. You want to report all medications, and this includes supplements from the outside to your doctor, so we can make sure that they're not interacting with any of your cancer treatments. What I don't recommend is, if you go online, particularly like the Goop website, you may see something about vaginal steaming or V-steaming or vaginal detox. So if you want to talk about a detox of the vagina, go back to the beginning of this presentation where I talk about avoiding all of those chemicals. But your vagina, you don't need to buy a product that's like a vaginal detox, and you don't want to do a steam, because steam actually doesn't get into the vagina. The vagina is actually kind of like a collapsed tube. And so any type of product where you're like putting hot steam close to the vagina, you're really just at risk of burning yourself. Furthermore, if you look at the marketing for these steaming products, they claim to cure like all different types of things like endometriosis, headaches, weight gain. And so anything that is claiming to fix all of these problems that are unrelated, I would just be a little bit wary of that. Feminine washes, there's entire aisles at the grocery store dedicated to this, brands under Vagisil. You actually don't need these soaps and fragrance products. And some of those chemicals in those products have actually been linked to ovarian cancer. And so it's an entire industry. And now, unfortunately, Vagisil is even marketing one of their new products called OMB to like teens. And it's just, obviously, there's a lot of problems with that. There's something called jade eggs, which you can also find on the Goop website, which I actually don't recommend anything from that website, but these are like pieces of jade that you place in the vagina. I do not recommend this. This can make pelvic floor muscle dysfunction or those spasms that I told you about much worse. So I don't recommend jade eggs. The other treatment that I often get asked about is vaginal lasers. So these are things like the Mona Lisa Touch or other types of brands similar to that. So vaginal lasers actually work by targeting water in the tissues. And so the studies showing, so these lasers were actually developed for other parts of the body, like the face or scars, etc. They were not FDA approved to be used in the vagina. And so the way they actually work is by creating tiny little burns in the mucosa or of the vagina. And for women undergoing normal menopause, where the estrogen is going down little by little by little over time, these devices may have an effect where they increase lubrication or elasticity. But for women who are on aromatase inhibitors, so that's anastrozole, letrozole, and exemestane, I do not recommend using these vaginal lasers. The reason is that we've put you on a medication that makes your estrogen so low in your body. It's not natural, but it's what we're doing to prevent the cancer from coming back. But the way that the delicate tissue of the vulva and the vagina actually heal has to do with estrogen. And so the healing mechanisms there are completely disrupted. So something that causes a bunch of tiny little burns is not going to end well. And so I've actually had patients who have had bad reactions to these lasers. They're cash-based fee-for-service devices. And so, for some women, maybe on tamoxifen or undergoing normal menopause that's not related to cancer treatment, they may be helpful, but I don't recommend them for patients on ovarian suppression or aromatase inhibitors. Recently, the FDA also asked these companies to kind of roll back their marketing because vaginal rejuvenation is a marketing term. I also want to caution you about surgical cures. So, everyone's anatomy is a little bit different. And so sometimes doing surgery on the vulva and the vagina, sometimes it's definitely indicated. But other times these like labiaplasties or vaginal rejuvenation procedures can actually put you worse off than you started, meaning they cause more pain than you were having from the beginning. So with that, I want to just close and say that, start today. If you're having some of these symptoms, moisturize, every day or 3 times a week. You want to use lubricants every single time for sexual activity, and consider using a dilator, and pelvic floor physical therapists can really help with that. I recently read this book, Ultimate Guide to Sex and Disability, and I know it has disability in the title, and so I don't ever want any of my patients to think that I think of them as disabled, but there's actually a lot of helpful information in this book. It's talking about speaking to patients who've had different types of surgery or treatments where their body's just different than it was before. And so I thought that it gives a lot of good tools for kind of managing that and figuring out what's good, what works for you, and safe ways of doing things. So you want to start the conversation with your oncologist. We want to help you. And so even if you bring these symptoms up to your oncologist, if they don't know the answer to your question now, like 5 people ask about their vaginal symptoms that day, they're going to go home and they're going to look it up and they're going to come up with resources and solutions for you. So ask the question. And so we can start talking about this. You want to ask for a referral if you need it. So urogynecology helps with leaking urine, coughing, sneezing. Pelvic floor physical therapists can help with dilators. Sexual therapists, psychology, psychiatry, all of these can be really great resources. I recently put together a workshop, 2 hours for some of my amazing colleagues from radiation oncology, pelvic floor physical therapy, and social work / psychiatry, psychology. We made a workshop. Actually, I just saw that this says workshop. I saw a little typo, but it's on the Sylvester Cancer Center YouTube channel. It's 2 hours, and we have it both in English and Spanish. So check it out. If you found any of this interesting. So you can also check out the Music Sex After Cancer Instagram. I try to post updated information and about new products or services and new information for women who are living anywhere and may not have access to a music program like we do at Sylvester. So I just want to end with that, you don't have to get it perfect, and you just have to get the process started. So sometimes just putting a plan in place and making a decision to, I'm going to talk about these problems and I'm going to start trying to address them can be really helpful. So with that, I just wanted to, I can open it up for questions.
Thank you so much, Dr. Rojas. I learned a lot, by the way. So thank you so much. Feel free to ask any questions, whether you want to unmute yourself or type a question in the chat via Huba or Zoom. And also just another reminder that the survey is in the chat for those who need the CEUs. That's something that you will be required to do. And of course, we just want to hear about your feedback. So thank you so much. I think that there is one question, Doctor. One moment.
Yeah, someone was asking about the book. And so this is the book I was talking about. And I actually just got the electronic version on Amazon and read it in like 1 day. So it's a pretty short book, but I thought it was really helpful. It's written by a doctor, and it has a lot of helpful tips in there. This is a sensitive topic, so if anyone has any questions that maybe they don't want to ask in our group, you can also reach out to me through Instagram or through Sylvester, and I'm happy to answer any of your questions that come up.
We do have a question for you, Doctor. The question says, do you recommend women who do not have cancer to moisturize as well?
Yes, that's a great question. So I think that women who are experiencing these symptoms, who are going through normal menopause or who are having other issues, menopause, as I said, is when the estrogen goes down little by little over time, and the delicate tissues of the vulva and the vagina can have these symptoms. And so I do think that basically almost everything I talked about today totally applies to women who don't have a history of cancer as well and just are going through menopause.
Someone asked, what does a pelvic floor do?
pelvic floor PT or pelvic floor physical therapist. Yeah, they're actually called pelvic health physical therapists. So now, and I recently learned this from our amazing pelvic health physical therapist at Sylvester. So a pelvic health physical therapist is a physical therapist specifically trained in all of the muscles, joints, and problems that can happen in the pelvic floor, which is that bowl of muscles that I kind of told you about that holds everything in. You know, some women who are in car accidents or who have certain back problems, you know, all of this can be related to, or who have injuries from surgery, or oftentimes we'll use a pelvic floor physical therapist for different exercises, stretching, etc. But I have found that they're extremely helpful for women who are having issues with sex after cancer, because a lot of times it's because the vagina has narrowed or it's shorter, or there's a lot of that pelvic floor muscle spasm. And so I think that they're really helpful in helping patients with a dilator program. So dilators are those tubes that I showed you that you've started a small size and kind of work your way up. And they're helpful. You do it by yourself. It's basically like, you know, an exercise, and it helps increase the length of the vagina. And if you're someone who's had vaginal narrowing with treatment, they can be really helpful for that too. And a pelvic health physical therapist can really help walk you through that as well. They're also really helpful for if you're someone who has leaking of urine with coughing and sneezing or other issues with your bowels. They can be really helpful for that as well.
Thank you so much. So the next question that we have, it states, is there a good online resource we can refer patients to where they can find safe products? Because there's a lot of miscommunication and
yeah,
out
definitely.
there.
Yeah, of course. So that's kind of one of the reasons I put together the Music Sex After Cancer Instagram, is to fight misinformation and to show like, this is what we have evidence on and this is what we don't. And so that's why I made it that way, and because it's a real problem, and not just with regards to what's safe after cancer, but with regards to women's healthcare in general. And so I'd recommend that. I also would recommend checking out our YouTube, and then, you know, other good sites are would be websites like A.C.O.G.org. So that's A.C.O.G. That's the American College of OBGYNs. A.C.O.G.org has a website, and you can click for patients, and it's basically patient-centered information on all different kinds of GYN related issues. So that is a great website. For patients who are experiencing menopausal symptoms, there's a website called NAMS, which is the North American Menopause Society, NAMS, and there's a patient tab on there as well. So they have a lot of helpful information about managing things like hot flashes, etc. And those are good sites.